Hearing is on. We're going to start this meeting. This is the Grand Terrace County Board of Commissioners special budget meeting. This is Wednesday, February 12th, 2014. And if we stand for the pledge, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. If we could have roll call, please.
Wheelock?
Yes, ma'am.
Rennie?
Here.
Thomas?
Yep.
Inman?
Here.
Max Bauer?
Here.
Lathrop, please excuse. Levenkool?
Here. Thank you. The first is the public comment. Is there anybody from the public who'd like to make comment? Then I'm going to dispense with reading the rules. Next is the Health Department is going to make their presentation on, and Wendy, you're up for that.
All right. So the Health Department umbrella, the fiscal umbrella, actually encompasses 5 different divisions: environmental health and animal control, community health, emergency management and preparedness, the Office of the Medical Examiner, and administration and finance. If it's okay, I'd like to introduce the division directors real quick who did come here today, since you don't see them all that often. Environmental health and animal control is Tom Buss. Just raise your hand. In community health, because we have so many programs, there's 2 nursing division directors, and that's Martha Thorell and Jody Kelly. And the Office of the Medical Examiner is Dr. Houghton, who's not here. Emergency management preparedness is Greg Bird. And then administration and finance is Jerry Pugh. So the scope of the services that we cover under these divisions is very broad and comprehensive. Our total budget's about $5.6 million, and about $1.3 million of that comes from the county's general fund. I am going to cover a lot of programs. There's a lot of slides. There's about 52, I believe, between Jerry and I, because we have 90 minutes and we have 30 programs. So if at all possible, could we go through all the slides first and then take questions? You did ask for a lot of information, and so we wanted to be able to provide you with that information. There are many essential local public health services that are mandated, and they're mandated under a cost shared service between the state and the locals. It's under Michigan Public Health Code, Act 368 of 1978. And the funds that are appropriated for these operations are allocated for the following programs: infectious disease control, immunizations, sexually transmitted disease control and prevention, hearing screening, vision services, food protection, public water supply, private groundwater supply, and on-site sewage management. I'm going to start with the Environmental Health and Animal Control Division. This division is mandated by Michigan Public Health Code to prevent disease and protect human health through the prevention and control of environmental health hazard. So this includes complaints and consultation with residents about water quality, sewage, and indoor air quality. The division also houses animal control and partners with Cherryland Humane Society for sheltering of the animals. There's 9.4 total FTEs in this division. So the first program is food service, and this is the inspection of restaurants and other food vendors such as like festivals, carts, and it's for the protection of food sources and prevention of disease. The customers are the general public, essentially anybody who owns a food establishment, and the people who are served are the people who have the inspections, and then essentially anybody who eats at one of these food establishments. So probably all of our citizens, and then many, many, many more with the number of tourists we get. Cost of the program is about $300,000. The funding sources are the state comprehensive funding contract. This is a contract we get from the state that covers all of the essential services I listed, plus many other programs in our community health division. It is a mandated service, and this program covers 2.65 FTEs. Public water. This is monitoring of wells for businesses and schools for contaminants such as coliform bacteria and nitrate concentration. So it's anyone who utilizes the business and the school water are the customers. There's 145 facilities permitted annually, but obviously the reach is greater than that, as it's anybody who uses the water at those businesses. The cost of the program is $48,000. It's funded from the state DEQ contract and county funds. It is mandated, and the FTEs for this program are .475. Private water is the issuance of water well permits for homes to ensure compliance with the state construction code and provide safe water. It affects anybody who uses wells as their water source. There's 337 annual permits, but the reach is greater. So anybody who's visiting the home of people who have wells. Cost of the program is $112,000, and the funding sources are the state comprehensive funding contract, permit fees, and county funds. This is another mandated service, and the total FTEs allocated are .975. On-site sewage. This issues permits for construction of sewage disposal systems to protect our lakes and water supplies. It affects all Grand Traverse County residents, anybody who is in those lakes and water, and many visitors. There's 788 annual permits. Cost of the program is $282,000. Funding comes from the state comprehensive funding contract, permit fees, county funds. It is mandated, and there are 2.5 FTEs allocated to this program. Shelter. This is the inspection of campgrounds, public swimming pools, adult foster care and child care facilities, septic hauling vehicles, and monitoring public beaches to prevent the spread of disease. This affects all Grand Traverse County residents and visitors who might use these resources. We do 135 annual inspections and tests. Cost a little over $51,000. The funding is from the state DEQ contract, license, inspection, and other fees, and county funds. All of these services are not mandated, but the state law does require that if there are test results from the beaches that exceed the limits, that must be reported publicly, which we currently do and have for many years. And there's .45 FTEs allocated to this program. Animal control. This is the enforcement of the state law and local ordinances to ensure licensing and vaccination of dogs to prevent the spread of rabies. It affects essentially any Grand Traverse County resident. We inspect, or we follow up on over 1,000 complaints annually. There's many other things they follow up on, so it's kind of hard to quantify. And it affects all pet owners or anybody who, say, has been bitten by a dog. The cost of the program is $213,000. The funding comes from licensing, inspection, and other fees, county funds. It's not mandated, but there are a lot of statutes and mandates on how it is to be offered and how you can do it as a county board. And there's 2.35 FTEs allocated to this. This is the dog law of 1919, and it actually kind of lays out the different specifics. I'm not going to go into this today. I just put this in there for your information because I know you all have been emailed the PowerPoint. But in case you had questions about it, it's there for you. Now we're going to move on to the Community Health Division. So the Community Health Division programs protect and improve the health status of the community. They prevent and control the disease, disability, and death associated with communicable diseases and promote healthy lifestyle factors. There's two, areas of services: maternal and child health, and then disease control and prevention. And there's 37.4 total FTEs allocated to this division. Healthy Futures. Healthy Futures is a collaborative program with Munson Medical Center, and it provides nursing home visits and phone contacts for all pregnant women and families with children ages 0 to 3. It's to improve the access to health care, immunization rates, and breastfeeding rates. This cost center also includes Head Start screenings and some other infrequent services that we provide. We needed a place to put them for the cost center. Customers are all Grand Traverse County new moms and families. The monthly caseload is 976. Cost of the program is $98,331. And the funding comes from the state comprehensive funding contract, local contractual agreements, that's Munson, fee for services, and county funds. This is not a mandated service. It is a regional service that has just been deemed a promising practice, and they're hoping to expand it to 21 counties. And there's 0.9 FTEs allocated to this program. Family planning and reproductive health. This provides accessible reproductive health services to women and men, including medical exams, counseling to prevent unintended pregnancies, contraception, and sexually transmitted disease testing and treatment. Customers are Grand Traverse County residents in need of reproductive health services. There's about 4,500 annual client visits. The cost of the program is about $369,000. Funding comes from the State Comprehensive Funding Contract, client collections and donations, Medicaid fee for service and cost settlement, private insurance collections, and county funds. It is not mandated, and 2.825 FTEs are allocated to this program. The Breast and Cervical Cancer Control Program. This provides exams, testing, and referrals to detect and prevent breast and cervical cancer in uninsured women. Customers are uninsured women in our county. We serve 142 women, plus we do the coordination of their care. So that's case management, and that takes sometimes quite a bit of time. The cost of the program is $35,000. It's funded from fee-for-service billing and county funds, and it's not mandated. But with the Affordable Care Act coming into place, we kind of believe this program will probably eventually be phased out because there will no longer be uninsured women. So they'll be insured, and then they would be covered under billing for insurance, or they'd qualify for the expanded Medicaid. And 0.3 FTEs are allocated for this program. The dental clinic. This is a contractual financing mechanism with the Health Department of Northwest Michigan to assist in providing dental services to the Medicaid recipients in our county and those who are underinsured in our county as well. They have a special Northern Dental Plan for that. Customers are anybody in our county who's on Medicaid or uninsured. They serve over 6,500 people annually. Cost of the program is, on paper, $50,000. It's county funds is the source. It's not mandated, and there's no health department staff assigned to this. We do assist with outreach activities, and you'll see where that's allocated later. And this is, again, a contractual arrangement with Health Department of the Northwest. Maternal and Infant Health Program. This is a home visiting program for pregnant and postpartum moms and infants to reduce infant mortality and morbidity, promote healthy pregnancies and positive birth outcomes, and infant health and development. So customers are moms, babies, families in Grand Traverse County. We do over 3,300 annual visits. Cost of the program is about $790,000. Funding comes from fee-for-service, Medicaid, and the Medicaid cost settlement, and county funds. It is not mandated, and 7.575 FTEs are allocated to this program. Youth Health and Wellness Clinic. This is a clinic for students at the Career Tech Center and Traverse City High School. Services are provided during and after school with a mission to keep kids in school. The customers are Grand Traverse County youth aged 10 to 21. There's 1,400 annual visits. Cost of the program is about $372,000. Funding comes from a state contract through Michigan Primary Care, the fee-for-service Medicaid and the Medicaid cost settlement, client collections and insurance billing, local grant funds, and county funds. It is not mandated, and there's 2.85 FTEs total. The K-Town Clinic, which is located in Kingsley, is a sister clinic to the one I just mentioned. However, it's located in Kingsley, and its target is the middle and high school. Again, the services are to try and prevent kids from missing school due to illness. Customers are, again, youth aged 10 to 21 in Grand Traverse County. It's 1,100 annual visits. The cost of the program is a little over $375,000, and this has the same fee or funding sources as the previous clinic. It's not mandated, and there's 2.575 FTEs allocated for this program. Women, Infant, and Children. You probably know this as WIC. This is a supplemental nutrition program that serves low and moderate income pregnant, breastfeeding, and postpartum women, infants, and children up to age 5 who have nutrition-related health problems. So the customers are moms and families with low to moderate income. They have a monthly caseload of $2,400. Cost of the program is a little over $432,000. Funding comes from the state comprehensive funding contract and some county funds. This is not mandated, and there's 4.5 FTEs allocated to this program. The Breastfeeding Peer Counselor Program. This is a kind of a sister program to WIC. It's a support program that provides mother-to-mother counseling, educational resources, and breast pumps for women who are returning to work or school. So the target is Grand Traverse County WIC moms. We serve over 600 women annually. Cost of the program is almost $49,000. Funding comes from the state comprehensive funding contract, county funds. It is not mandated, and there's 1 FTE allocated to this program. The regional epidemiologist. We house a state employee in our building. So this cost center was established so that we could substantiate the costs incurred for providing this office space to the state of Michigan. The Region 7 epidemiologist serves 17 northern Michigan counties, including us. We're the largest. The cost of the program is $7,616. Funding comes from the state comprehensive funding contract, county funds. It's not mandated. And staffing from the health department is 0.05 FTE administrative secretary. Vision program does screenings for early childhood, preschool, and school-age children to identify vision problems requiring additional follow-up and evaluation. Customers are all Grand Traverse County children. The number served, 6,450 for last year. Cost of the program is just under $80,000. Funding comes from fee-for-service, Medicaid, and Medicaid cost settlement, state comprehensive funding contract, and county funds. It is mandated as part of the cost-sharing agreement, and 1 FTE total is allocated to this. The sister program is hearing. They're screening for hearing problems. Same target, 4,651 children served last year. Cost of the program is about $80,000. Same funding sources, same staff allocated. Children's Special Health Care Services. This provides case management, insurance coverage, and referrals for specialty care, family-centered support, and coordination to children and adults with special health care needs. Customers are all Grand Traverse County families who have special needs children. The monthly caseload is about 300. Cost of the program is $149,000. Funding comes from the state comprehensive funding contract, the federal cost reimbursement. It is not mandated, and 1.45 FTEs are dedicated to this program. Medicaid outreach. This is a cost center that's established to identify Medicaid outreach activities that we perform, mostly in the community health clinic programs, and it allows for securing funds to assist in connecting eligible residents with available resources. So the customers are all Grand Traverse County residents eligible for Medicaid. It serves over 17,000. Cost of the program is $572,000. The funding source comes from the federal matching funds and the oral health outreach contract. This is a contract with Health Department Northwest. Since their target population is the Medicaid population and uninsured, they help fund an outreach coordinator position. And there's 5.55 FTEs dedicated to this. You can see it's a lot of people. Jerry will probably explain this in a little more depth later on. He's the financial guru. Electronic health record. This is a cost center that we established so that we can transition from paper charts to electronic health records in all of our clinics. It includes costs for planning, design, and implementation. The actual technology fees would be assigned to the actual clinic program where the EHR was implemented. Customers are our internal clinic service programs and the clients served in the programs. The cost is $70,500. The funding source is federal Medicaid incentive funds and county funds. It's not mandated, but there is incentive money, which is that federal Medicaid, to switch over to EHR. And there's 0.65 FTEs dedicated to this program. Communicable Disease Program. This monitors the occurrence of infectious or contagious diseases in Grand Traverse County through surveillance, disease investigation, and detection of pathogens in order to treat, prevent, and further spread the disease and educate the public. This is something that nurses every single day are always monitoring. Customers are all Grand Traverse County residents and visitors, so the number served is 90,000 plus. Cost of the program is $157,500. Funding comes from the state comprehensive funding contract, fee-for-service billing, and county funds. It is mandated. Michigan communicable disease rules require that physicians and labs report over 70 different diseases to local health departments every day. I'm not saying there's 71 or 70 diseases reported every day, but they have to report anything as it comes up, because that's when our nurses kick into action and try to make sure we're taking care of all the contacts. There's 1.5 FTEs dedicated to this program. Sexually Transmitted Disease Program. This provides testing, diagnosis, treatment, and partner follow-up of sexually transmitted diseases to decrease the spread to others. Customers are all Grand Traverse County residents and their sexual partners. Serves over 500 people a year. Cost of the program is just under $75,000. Funding comes from the state comprehensive funding contract, fee-for-service billing, and county funds. It is mandated, and 0.55 FTEs are dedicated to this program. Emergency Management and Preparedness Division. This division enhances emergency readiness in the county by developing strong relationships with local partners. That's through our LEPC and LPT meetings that Larry and Herb are part of. And first responders, developing response plans and educating the community. There's two programs. One is emergency preparedness, which is strictly focused on public health types of disasters, and emergency management, which is a more global, all hazards, all types of disasters. There's 2.4 FTEs in this division. So emergency preparedness is creating community readiness capacity to prevent, protect disease, respond to, and recover from public health emergencies, disasters, and bioterrorist events. It affects all residents and visitors who may be here during an event. So 90,000 people. But for these programs, we have to plan for the seasonal surges and visitors, or however many people may happen to be in the area. So we typically plan for about 120,000. But we get funding for the 90 for our population. Cost of the program is about $139,000. It's from the state comprehensive funding contract. It's not mandated, and there's 1.4 FTEs allocated to this program. Emergency management. This creates the framework to reduce vulnerability to hazards, improve the community's capability to mitigate against, prepare for, and respond to, and cope with all disasters. So customers, again, residents and visitors. Same number served as emergency preparedness. Cost of the program is about $119,000. Funding comes from a state emergency management contract that's through the state police and some county funds. It is mandated to have an emergency manager, and there's 1.0 FTE allocated here. Office of the Medical Examiner. The Office of the Medical Examiner is mandated under state statute to investigate reportable deaths, sudden, unexpected, accidental, or violent deaths, and has the authority under statute to order an autopsy to determine the cause and manner of death. Medical examiner provides consultation with law enforcement, provides court testimony if necessary, and assists with the review of all child deaths through the Child Death Review Team. And that's for any deaths 18 years or under. So I don't know if I'd call it customers, but it affects anybody who dies in our county potentially. There's about 1,200 deaths that happen in our county About 800 of those are actually Grand Traverse County residents, and about 150 of those are actually referred as true ME cases. But the medical examiner probably touches about 1,200 cases a year, whether he's signing a cremation permit or referring back to a physician or referring to another county, so there is time involved. Cost of the program is about $169,000. Comes from county funds. It is mandated, and it's not a contract, but we pay the medical examiner based on a fee structure, and he does have some support staff that he pays out of his funds that he receives. Last division, administration and finance. This division provides administrative, clinical management, accounting, and financial management services to all the divisions within the health fund. The costs affiliated with providing these services are allocated to all the appropriate program cost centers, different ones I just talked about. And it's according to the cost allocation plan that utilizes relative payroll costs. The budget for the core services and administration also includes county indirect costs, which are allocated to our health fund. So that would be human resources, county administration and finance, facilities management, the prosecuting attorney, or the treasurer, for example. There's 5.1 FTEs allocated in this division. And it's a combination of direct and indirect services. So some of our time is directly attributable to a program, and some is more of an indirect cost. I mean, it's services like financial management and grant reporting, program development and monitoring, development of the medical protocols, that would be under our medical director, community health assessment and planning, records retention, internal policies and safety procedures, like OSHA manuals or bloodborne pathogens, accreditation coordination, community collaboration initiatives, medical consultation for individual cases, enforcement of our public health laws, hearings and appeals board activities, and our cost settlement calculation. So here's the three program cost centers. Administration, which is 100 and, says administration, but this is really finance. It's just called administration. It's about 136,000, and there's 1.6 FTEs, which you can see are all finance or accounting. And I forgot to mention earlier that our main accountant and kind of grant person is Erin, and she is here in the room, so she's under this cost center. Core services, that's $188,000, and that's 1.7 FTEs. So this is a portion of the health officer, some secretary time, outreach coordinator, and then a portion of our medical director contract, and then nursing administration, which is 1.8 FTEs and about $167,000. So you can see that that's a lot of programs. It covers about 66 employees under the health fund and accounts for roughly 55 FTEs. There's 30 programs across the 5 divisions. Our services touch all the citizens. And we feel, or at least I feel, that our programs provide a tremendous benefit to the citizens of our county through the wide range of services that we offer. And it's mostly in part to having a very knowledgeable, dedicated, and competent staff. With that, I'm going to turn it over to one of those people, and that's Jerry. He's going to talk about some of more complicated information for you.
So the health department budget is complex, as you can see from the 30 cost centers that we have to track all of our services. We have a broad scope of services that Wendy has mentioned. Each of those services has a different variety of funding sources, and we need to make sure our accounting is adequate to be able to do the necessary reporting for each of them. So we do have a fairly detailed cost accounting system, or maybe not cost accounting, but we have a very detailed accounting system. We strive to maximize the federal dollars that are allocated to us, and also to utilize the county investment in the programs that we do. Part of that is through the Medicaid cost settlement reimbursement process, which I'm going to talk about in a little bit more detail. Also, we constantly leverage all the local, or essentially all the local dollars that are allocated to the health fund. And a good example of this is the contract that we have with the Traverse Health Clinic, where in the current year we have about $380,000 that is shipped off to the state of Michigan, and that actually provides them with about $500,000 in funding for their operation. So by the time you take all the match dollars that are required in our budget to match all the federal dollars we receive, and this piece that we work out with the health clinic, it essentially leverages all the local dollars that are within our budget, with the exception of the medical examiner, emergency management, where there is very little possibility for that. Another thing that makes our budget very complex is the fact that staff are typically assigned to multiple programs. So this is just to give you an idea of this. This is actually 1 page out of 4 for our staffing plan. So you can see that the majority of staff are allocated to multiple programs just because they are cross-trained, or they're working in multiple programs within the department. The few exceptions to that would be like Greg Bird, who's strictly dedicated to emergency management, or our 2 animal control officers. Essentially, all the other staff are allocated through the budget process to these various programs that we do. So the cost settlement reimbursement process, this is a process where the health department is reimbursed a portion of the cost of providing Medicaid services that is over and above what we are actually able to bill Medicaid on a direct fee-for-service basis. This percentage changes from year to year, and I've just listed here settlement amounts for the most recent 5 years. A couple of these are still pending, but the whole point here is this is becoming a more and more significant funding source for us. And from time to time the rules change, and it's been a good source of revenue for us, but it's also kind of an uncertain source of revenue as well. So as we approach and do accounting for these funds, we always approach them with extreme caution. So year 2011, we have received an initial settlement. Again, this whole process, it's dependent upon a number of factors. One, program costs. The primary programs that contribute to this settlement reimbursement process are the immunization program, the family planning program, and the maternal infant health program. Also, our 2 adolescent health centers have come into play in this, and also a small portion of the hearing and vision programs, where we're providing services to some very young children. That also factors into this computation. The process is also dependent upon the number of what they call encounters during the settlement year, which is a face-to-face visit between a practitioner in like our MIHP program or our family planning or adolescent health centers, where they actually provide some sort of visit. Another factor is the federal Medicaid assistance percentage. This is recomputed each year by the federal government, and it does change. It increased significantly with the downturn in the economy, and the percentage is determined by looking at the average income of a Michigan resident compared to the national average. So there's been times where it has creeped up.
as, if you look on this federal or this previous slide here, you can see it got as high as 76% in 2011. And I'm sure that this rate, takes a year or two to catch up to current economic conditions. The other problem with this whole reimbursement process is that there are regulations or procedures that are established or implemented by CMS, and they're kind of, not always, we don't always know in advance what's going to happen. For instance, about 4 months ago, we were told that a visit code 99211, which is kind of a limited scope visit that in our family planning clinic is performed by a public health nurse, that visit was no longer going to be included as an encounter under this process. So many of my colleagues at other health departments were immediately kind of upset about this. But when you start going through the numbers, this change actually increased our reimbursement amount. So it's kind of a crazy result, but just depending upon the mix of services that you provide, Aaron's been busy computing this the last couple of days. For 2011, our reimbursement under this revised computation actually increased by about $175,000. So whether this will stick or not, I don't know. I kind of think that whoever made this change had not actually computed the ramifications of it. So this slide just shows the various percentages that the different revenue sources provide to our budget. State and federal funds are about 1/3 of our budget. Medicaid and cost settlement is almost 1/4. Private medical insurance billing is between 4 and 5%. License permits and fees is about 10% of our budget. Local grants are a fairly small portion. From time to time, that percentage increases a little bit. And county appropriation is somewhere in the 30% range. So potential concerns that could impact our services, our revenues, are the implementation of the Affordable Care Act and the Michigan Medicaid expansion. We don't really fully know what kind of impact. We think that, we may be providing a lot more services as a result of this legislation. We have been notified that Plan First, which was a Medicaid carve-out, will be ending in April. We have some concerns about that, but if eligible individuals do seek out other health care, it's kind of a logical progression as well. So that, could have some impact on our funding as well. The state seems to be pushing towards or having an emphasis on regionalization of services. So how that's going to flow down to us, we don't really know. We are talking with our regional partners to see if there's any opportunities to, provide services together. And, so that's another thing that, is out there and will be impacting us. Demographic changes that will impact our activity or revenue, again, getting back to the Affordable Care Act and Michigan Medicaid expansion, we know that legislation will probably have an impact on the number of services that we provide, as well as the growth in population. We're probably going to have more services or an increased demand and more services to provide and monitor. We also have already seen that the improving economy is increasing the number of environmental health services that we provide. Potential sources of revenue increases that we've been able to identify.
Every day, we're trying to keep our eyes open for any opportunities, and Wendy and I have had some discussions with local providers of services, funeral services, and we've identified that this is a possibility that maybe Grand Traverse County should pursue, that maybe there should be a fee for cremation permits. There are several other counties, or there's a couple of counties in northern Michigan that have started doing this, and probably many more downstate. So it's something that we're going to continue to look at and work with Dave and Dean and pursue this as a possibility. With the increase in Medicaid enrollment and private insurance enrollments through the Affordable Care Act, we'll also continue to pursue, billing for as many services as we can, and hopefully that will provide for some enhanced revenue. As we're forced to look to local grants to continue to provide services, as Wendy has already mentioned to you, funding was eliminated for beach monitoring, so we're hoping that, maybe applying for a 2% grant, we may be able to continue to provide that activity, which we feel has been very beneficial to Grand Traverse County residents. We're also constantly looking for alternative ways of providing services. Much of what we do, we don't feel is something that we could really outsource to someone else. The majority of the costs included in our budget are staffing with public health nurses and sanitarians. An example of where we've explored this, social workers, we did have a contractual arrangement a number of years ago in our MIHP program. We eventually decided that we really needed to go to having those social workers under that program be employees, because we were essentially controlling what they were doing and needed to have direct supervision of them and integrate them with the other staff that work in providing those services. As well, we kind of struggled with what to do at our adolescent clinics. We started out in a contractual relationship with Third Level. We then thought, well, maybe if we went to an employee situation there, we may be able to bill for those services. But as we didn't have anyone in-house that could provide the necessary supervision, we've kind of, backed off of that plan and gone back to a contractual relationship. So it's just an example of us exploring those opportunities, and we're going to try to work out what best meets the contractual obligations that we have in providing the services under these programs. We do have several existing situations where we have shared services, as we do with Dr. Collins, our medical director. We do share his services with Benzie Leelanau and actually reduce the cost of his contract as a result of that relationship. Our medical examiner is also a medical examiner for the same two counties. More recently, we established the contract with Cherryland Humane Society. We're only, 8 or 9 months into that agreement, so we don't fully know, how well that's working, but, we think that's going to be a good example of where we've, searched out an alternative way of doing business. Wendy's been very involved in this cross-jurisdictional sharing project with other health departments and folks in northern Michigan, and we continue to look at other ways to collaborate. Dental Clinics North is, a fine example of a long-term collaboration that we've established. Years ago, the dental clinic was actually operated by the health department, and I think it, cost the health department a fair amount of money. And we've basically, through Dental Clinics North, they've established a great model that we are no longer supporting with funds. They're actually providing us about $45,000 a year to do outreach for that clinic. One of the questions we were asked was, what would we do to implement a general fund budget reduction, and what impact would that reduction have upon services? I looked back through our county fund appropriation. Our requested county fund appropriation, when we initially met with Dave and Dean, we were asking for about a $268,000 increase. It was kind of like our wish list budget. As we were asked to cut things, we basically turned that around to where we reduced our requests so that our request for 2014 is $29,000 less than the previous year. Historically, our county appropriation has not been that low since 2007. Back in 2007, we had about 10 less FTEs funded under our department. We did not have either of the two adolescent clinics. So I think we've been, really good stewards of county funds. So I guess our response there is that we have already made significant cuts from our budget, and we don't really feel that we can do anything more without really gutting services in a program. Not all health department services are mandated. However, majority of funding for programs comes from other sources to offset the cost of providing those services. And as I mentioned, most all of the local funds that are within our budget really do help to draw down federal funds. There's virtually very few dollars that do not assist in that process in one way or another in our community. If we were to eliminate some services, it's really hard to calculate some of those costs just due to the intricate nature of our budget. But I mean, it's possible, but you virtually have to go through the personnel portions and do some significant computations to determine that effect just due to the complicated nature of our overall budget. As we've reorganized, we've looked for ways to become more efficient and cost-effective, especially in scheduling and staffing. Martha, Jody, Wendy have worked to revise the schedule so that services can be provided in a more fair, consistent coverage and programs with staffing. We've used to routinely pay a significant amount of extra hours for staff, and that has been virtually eliminated by making sure that everyone requests any extra time that they may need to work. So between changes in the scheduling and actually just making staff more accountable, I think that you're going to see some savings in payroll costs from this need for extra hours. We've had more staff availability for all programs and more ease in scheduling as we've gotten more robust cross-training. We've been able to fill in where there's absences or backup that is needed without calling in part-time staff. So I think the division directors are all working together, working collaboratively with communication. We all, work together to meet the staffing needs. We have community health staff going over to assist Tom at environmental health. We have accounting staff that goes to the front desk or to the adolescent clinics to fill in when we need to. We've also done a few things that, we feel are really helping to provide better service to the clients, where we're having someone at our front desk in the new building during the lunch hour to answer clients' questions. In some cases, we do immunizations through the lunch hour. And then again, just reworking the schedule so that we have more clients scheduled through our late clinics. We've done a good job, I think, in working with the other county departments to use the resources that we've had available to us. An example of this was a number of years ago when Don Sheehan was being forced to reduce staff. We fought for and agreed to fund half of the IT tech position at the health department directly out of our funds. Quite honestly, having a full-time FTE at the health department to support the 86 computers that we have throughout the department, including, computers for emergency management and all our clinic rooms and that, it's really a struggle for Rich to meet our needs. So we have worked with, to make things work. We have come up with funding out of our programs to be able to continue to keep the support that we have. We have also, worked to build the technology and software upgrades. I think when we got a kind of direction from Dave to upgrade computers older than a certain model, we basically are going to be able to accomplish that with the budget that we've presented for 2014. We're also moving forward, transitioning to document imaging at environmental health for the well and septic records. And we've been able to do this just because we had additional funds available within the environmental health programs for the last year. We're also, as a result of those funds, able to make some payments to support other staffing within the IT department. So we're really making every effort to assist other county departments to continue to help us meet our needs. I think this is also evidenced through our work with facilities management. If you get a chance, stop in environmental health. They just completed some office renovations there, and it looks great. So we're actually funding some of the facilities projects that maybe would be capital projects out of the future. So we're taking advantage of and using funds that might have otherwise gone back to the state to accomplish these goals. We've explored opportunities working with the sheriff and animal control, and I think, as a result of that process, we have established a better relationship, and unfortunately we've had some pretty unique circumstances over the past few months where, I think having that relationship established with the sheriff, it's been very beneficial. Water safety and beach monitoring. I know Tom and Wendy have also worked with Jason Jones and other members of the county departments to really address some of the concerns there, and we will continue to do that. We've also worked an awful lot with the prosecuting attorney's office, and I have to say that we've established a great relationship there, and they've been very beneficial in addressing a number of needs through animal control, medical examiner, court-ordered testing, and continuing to review all of our contractual arrangements. So our 2014 funding or budget that we have started working under, we essentially absorbed the increase in benefit costs and absorbed the wage increases for our staff, and are offering services at basically the same level as we have in previous years. And we're doing all of this with a county appropriation that has been reduced by 2.2% from the previous year. So I guess it's time for questions.
I should tell you what I wanted to do was just give you this one slide as our entire presentation, because I think this says it all. We absorbed the costs of the benefits, we absorbed the wage increases, we're offering the same services, and we're actually getting about $29,000 less than previous years. But I was taking it as an opportunity to educate you all on all of our different programs.
I'm not sure who's...
Go ahead, Dave.
Okay, so when you looked at the slides and went through the dollars, and Jerry pointed out, there's a lot of outside funding that goes into each of these programs, even the non-mandated ones. So you can't really tell. What's not shown is how much county and how much outside. But there is a cap or a limit to how much you can cut the health department's appropriation. And it's called a maintenance of effort number, and it's different, it changes every year. And I don't know how far we are above that, but we are above it, but not substantially so.
I don't recall, Dave, but maybe $150,000.
Something like that.
I provided it to you some time ago.
And just wanted to make the commissioners clear on that you can cut some of these non-mandated programs, but you're only going to get $150,000 or whatever you can only go down to that maintenance of effort number, and you still have to provide the rest of it. The state of Michigan mandates that as part of the cost-sharing agreement. So just wanted to clarify that. And I wanted to thank Jerry and his staff for the Herculean effort they put in during the budget process to help us out because we really needed to get that budget balanced. And as he explained, it's an enormous task to start rearranging numbers after you put your budget together because there's, 0.05% of Tom's, salary is allocated to, 6 different programs, and 0.75 is in, another part of the budget. And so every time you change something, you've got to change it all. And it's really a headache. But I really wanted to express my appreciation for that.
Yeah, we appreciate the county investment in all of our programs, and I think it's a good investment for you. For every dollar you're giving us, you're getting back in over $4 in services. So because of the way that we detail of our costs and leverage our local dollars and go for these federal dollars and reimbursements and grants.
I also wanted to notice that you skipped a slide, and that one of the things on that slide says that they moved all the nursing, the people who spend most of their day outside the office, to completely cell phones, got rid of their landlines completely.
Oh.
Which makes a lot of sense and saves money for the county. So they're always looking, and just about every department can claim.
We did that switch when we moved over. We really tried to look at who we could get away with doing that. It complicates things sometimes in that you can't transfer calls internally, but for that staff, they're out most of the day, and it makes sense. And or they're in a clinic room, and so they're not at their desk anyway. And then we also doubled up on our EOC phone lines. So those, on a day-to-day basis, those lines actually are in the clinic rooms. So there's phones there. If we have an event where we'd have to activate our EOC, then we would just remove the phones from the clinic rooms, and they would be put down in the EOC. So we're not paying 2 phone lines.
Sonny, you had your hand up?
Well, there's no question, and I've been around long enough to realize what the health department does for the citizens of our community, both those that live here and those that transition through here. The bottom line is basically 20% of their budget is funded by us. Would be, and I'm sure it's very difficult when we go through and we look at, where all of your funding sources are, and at the bottom it says county funds. It'd be kind of nice to have some idea what that fee costs in county dollars. But overall, I absolutely commend the health department and their staff for what services they provide for a community with what I deem to be a minimal expenditure to the taxpayers as a whole.
Larry?
A couple questions. Do you feel that your staffing level has maximized to the point where they cannot take any other types of services and consider it for the county? And I just want to throw this question out to you. Based on other counties or same size or even larger, do they have other programs within their health department that generate revenue that may or may not be mandated, that, like the cremation fee? I was kind of curious about that, about how you can charge a cremation fee, you know, when you basically do nothing. I don't know, maybe you do something, but it seems like you just take, you know, the remains to a place and they take care of it. So, but, you know, just give me a feel for whether there are some other types of services that other counties offer that we don't, that could bring in other revenue that we could look at, or do you think your staffing is maximized to the point where they couldn't take on anything more if there was something out there?
There's a lot in that question. I think our staffing is very close to being maximized, if not already maximized. That's why we went through and did a lot of the efficiencies, particularly in the community health programs.
Other
wanna
programs or
chime in?
services that are offered
I'm
out there
racking my
that
brain.
we're not in?
We
into?
offer probably more. Our scope is much larger than most health departments because
Okay.
we have the medical examiner. Some health departments have the medical examiner. Some have animal control, and 2 have emergency management, and we have all 3, which is pretty unique.
Okay.
The cremation fee, I'm just starting to dive in more on that, but I think it is a valid fee, and it does take time for the medical examiner to essentially, you can't cremate someone until you are assured that there's an actual cause of death and all the
Okay.
paperwork and everything is there. So it
Got
does
it.
take time, and it takes time to process that. And if a fee would be one way to generate some revenue to help cover some of the, you know, since Munson Medical Center is here and it's a big regional hospital, I'm not saying people come here to die, but more people are brought here and as a result die because the hospital happens to be in our county. If they die in our county, it becomes a Grand Traverse County death. Not all those deaths are ME cases, but they are. We don't get any of the death certificate fees. And that would be another source, but that would just be taking it from another county entity, so that's not really going to help you all. But it could be something that a portion of it could go back to offset some of the costs of the medical examiner.
Okay.
Are you
HIV.
aware of any other programs throughout the state that,
HIV.
we don't have that many HIV cases. I don't know that I would call that probably a revenue maker.
But the testing,
Well, we bill for HIV testing on a unit of service basis. We're reimbursed $11 for doing that. But as far as the partner notification and that, I believe it's done by District 10. That's something that's already been regionalized.
Okay.
They took that away from us, you know, probably 7-8 years ago, something like that.
You're going to have to come to the microphone, please.
She's saying we do HIV testing at our adolescent health clinics
Okay.
as well. Certainly with the expansion of the Medicaid in Michigan and the Affordable Care Act, we just don't know how much that's going to expand the need for services. But we have the clinic space. We would need to probably increase staffing once that demand gets to a certain point, but that definitely could be a revenue maker because that would be billing insurance. And we are set and poised to do that. Not all local health departments do billing of private insurance. We actually have some residents from other counties who come to us for immunization billing because we can bill private insurance. And last year, you may recall, I said that we got a special award, and that was through Aaron's efforts. We are one of the leaders in insurance building through the state, our health department is. So we're essentially ready to go with space and the ability to bill. We would probably need more staff if the demand increases, but we monitor our statistics monthly, so we'll see.
Yeah, a logical move, in my opinion, for the health department, especially, like in our family planning clinic, where we only have full-service clinics 2 days a week. We've got a lot of fixed costs sitting there, so by adding some staff, which we could likely, if the demand for services is out there, we likely could pay for that staff through billing for the services provided. So I think that's something that we need to monitor going forward, especially if, like, the breast and cervical cancer program goes away. We may still be able to do those services and bill for them on a fee-for-service basis, billing private insurance or Medicaid and paying for the additional costs that we would incur in doing that. I mean, we've got the facility, and it certainly is not being utilized to its maximum by any means.
Other questions? Sonny?
Two questions. Well, one's a comment and the second's a question. When I think about the adolescent health clinics, I remember when we started having the very initial discussions about whether we wanted to create those. They've evolved into something that I don't think anyone had any idea. We had no discussions about having to deal with pediatrics and infants and all of those kind of things when we had the initial discussions. But they certainly have provided a service to our community that was very, very needed. The second question that I do have, though, is in regard to animal control. And I don't know whether you guys can talk about that or whether it's Tom needs to talk about that. We spend $213,000 a year on animal control and truly have animal control available 9 to 5, Monday through Friday.
It's ridiculous.
And, I'm wondering if there's a better way we should be doing this, or is it something that if we can't do it, if we can't meet the needs of the community with animal control, should we be doing it at all? There's AC Paws, there's the Humane Society, there's a lot of organizations out there that weren't here a number of years ago and the county staff animal control. And I just wonder if there's a better way we should be doing that.
Well, just a couple comments, Commissioner. First of all, we do collect about $85,000 in license fees. Maybe with a change in the program, we can see that revenue increase. Maybe it's something that we could even pursue with the treasurer. I think the treasurer has to be on board with setting those fees. I'm not sure Dave could answer that. But so it is an expensive program. We still have $100,000 and some in it, but
Yeah, the net cost is somewhere around 25.
by the time this gets into, okay, we've got about $130,000 in county funds going in there, but you've got $22,000 in indirect costs, so it's costing us somewhere around $100,000 to do the program.
Okay.
There's also
What's our cost increase for going to
After
Sherman?
Dickey.
law enforcement leg to it, to have AC PAW and the others do it. You have to have animal control officers to enforce state laws, so that would be another issue as far as privatizing, I would think.
It's just interesting, since we went to contracting with Cherryland Humane Society, we've had a number of very unique situations too, and I think in most of them, law enforcement has been involved to some extent, haven't they, Tom?
Yes.
Mr. Thomas?
Very supportive of us, and we have needed Sheriff's Department in a couple cases this year already, and it is something that it's a collaborative effort, and something that we've appreciated their assistance, but we've had other significant events since the first of the year that we've dealt with and worked closely with Sheriff's Department.
And as much as we would like to just say, it'd be great if the Sheriff's Department handled it without Ed and Cindy's expertise of working with animals in these situations, I'm not sure that that's such a good idea either. I mean, realistically.
Yeah, there's actually statutes that talk about who's qualified as an animal control officer. I mean, there's a lot more to that. We certainly can provide you with that information if you want all that, but there's requirements. It can't just be anybody. And if there was no animal control, I guarantee that the sheriff's department and dispatch calls would probably go up. So you might see some increased costs in those departments as a result.
Mr. Thomas, you want to talk about cat licenses?
I'm going to talk about the same old thing I've been talking about for 20 years. How much is a dog license?
Is it $3?
We don't charge, we're not the
No,
ones who...
they're more than that, but, and it's more for a female, but I know that.
Yeah, there's a 3-year license. I don't know.
Yeah, but
It's collected by the treasurer's office.
I guess my point is, how much of your business that you take to the Cherryland Humane Society, how much of that business is cats rather than dogs?
Majority is dogs, occasionally there'll be cats involved.
Yeah.
Majority is dogs.
But you see, like in the newspaper every week, you see all these pictures of dogs you can adopt, and they're always half cats. Well, I think we're missing a revenue stream here that's costing us money. And cats have diseases. And they should have a license, and they should have their rabies shots or whatever they need. I just think you're missing a revenue source because it's costing you to take care of them, flat out. You don't take care of the cats for nothing.
We're not authorized under that dog law. Honestly, it applies to dogs. I'm sure that's something that we could explore.
Do you know of any places in the state that has cat licenses?
Do I know? No.
I'm not aware.
There
There
are,
probably are, though. But it would probably have to be, local ordinance would probably have to be
Well,
passed.
I think there probably is. We should
Chris,
investigate it.
just as a side,
Chris is next.
Oh, I don't mind.
No, go ahead.
I want to echo on what Sonny said. I'm looking at this, and I'm seeing 1,000 complaints a year. Divided by 52 weeks a year, it's a little over 19 complaints a week. If they only work, 5 days a week, every week of the year, you're only talking about, and you've got 2 people, you're only talking about maybe 2 complaints per person per day.
Some of them take multiple days to,
I'm not arguing,
yeah.
I'm not arguing that point, but, and this is costing us a sizable amount of money. So my question is there a way to turn this into some type of enterprise fund or treat it as an enterprise fund where it pays for itself? That's one question. The other question I have is, of these 1,000 complaints and cases, how many are indeed handled by the Sheriff's Department? Because as I'm looking at $213,000 annually for this program, I can see 2 sheriff deputies, which might serve us better. The other thing I've got a question on is the dog law. It says the Board of Commissioners, by ordinance, may establish an animal control agency. Doesn't say we have to. And the Animal Control Agency shall have jurisdiction to enforce this act in any city, village, or township. Why is the county doing this instead of the city, villages, or townships? How many of your complaints come from the city? So these are questions I have as we take a look at this program moving forward.
Larry?
I'm set.
Okay. I have a couple of questions. One is you moved into a new health department 4 years ago? How long has it been now?
End of 2012.
Oh, just a year ago.
a little over a year ago.
Okay, time slips by on me. How many of your adjustments have you been able to make because you moved into a new building that you would never been able to do in the old building?
They got used to living with a turkey.
Well, the reason why I ask this question is because sometimes we shy away from building new facilities, and we were talking about a jail here that sometimes it makes us so much more efficient that we can actually provide more services for the dollars that we are spent because we're more efficient, because we have a better facility.
Can I just make a comment before you answer? This was, I think, an appropriate time. Jerry had it on one of his slides, but when he mentioned the fact that we bill the health department for indirect costs, which include the facilities costs for that new building and the building that we have somewhat mothballed on Garfield Road. But we also charge the health department for rent, which covers the debt service, and the Dental Clinics North folks pay rent, so they are paying for 100% of the debt service on that new building, and that was the point that I wanted to make. When we made the decision, or when the board made the decision to build that new health services building, that was the agreement that we had with the health department, and they have lived up to that agreement. So they bear the cost of our debt service in the form of a rent payment. They obviously build that into their budget and recover some dollars on that where they can, but I just wanted that to be out there, that that service is fully covered by the rent that they pay, so.
The building, being in a new building, it has allowed us to do some changes that we wanted to do, but it's also forced us to do some other changes. It takes a while to adjust to a whole new workflow and new, just where everything's located. So that is something as part of the reorganization that we did last January, and that is really something that Martha and Jody in Community Health have really had to tackle. And so we just decided to dive in and look at everything all at once, and scheduling. And the schedule used to be kind of like this 1,000-piece puzzle, and there were so many part-time different days, and we really have a streamlined process, and the results have actually been really, really good. I don't know if I've answered all your questions, but.
Yeah, it's really still a work in process too, as far as that goes. I mean, we're not done on that front because, with people being located in different places now, we have seen some efficiencies in the clerical area especially, and we're continuing to try to streamline.
I just wanted to make that point because I thought it was important that the public understands that when you do build a new facility, it doesn't always cost you money, but it also makes you more efficient, and there are ways to be able to pay for those facilities other than out of general fund dollars. And that was my point on that. The other question I had is that you have a fund balance, and how much do you think a fund balance is necessary for the health department when it comes in dealing with your cash flow and everything else?
Well, our fund balance right now is about $1,300,000. We haven't closed the books on 2013 yet. Dean's been very patient with us because we're still struggling with this cost settlement and how many dollars do we really record, So, that's in excess of 20% of our annual budget. I don't know, that's a lot of money, but, if we had a huge outbreak in CD or something, it could evaporate pretty rapidly.
I came from a county in Illinois, running a health department before here. You probably all know Illinois is in a world of hurt fiscally. And our fund balance, once upon a time, before I even started there, was about 3 months worth of expenses. And the state grants, we were always balanced budget, but they were so far behind on paying the grant dollars that there were many months where we were borrowing from the county against our levy dollars to be able to pay payroll. And we were never in a fiscal situation where we were actually, we were always balanced budget or better, but it really put a lot of stress on the system because of that, because one of our main funding sources was sometimes up to a year delay in their grants. They always paid them, but they paid them late. So I'm pleased with having a fund balance that we do. We certainly don't like to go into it, but our cost settlement reimbursements, those are often delayed by a year or two. So, you know, we don't get that money immediately, so that does help. One other thing I wanted to add on the building is that the training room has been a huge improvement. Prior, at our old building, we had to use our EOC as our training room, and everybody was packed in, but one of the results, we host a lot of the regional meetings, so actually saves us money on travel and even some trainings. The state wants to put them on here because we have the space. In environmental health, not all counties offer a thing called Surf Safe classes, and it's for people who work in the restaurant industry, but we do. It's a revenue source. And they used to rent out space at Great Wolf Lodge, and now we're able to actually host those trainings internally. And so I think we're actually doing even more than we used to, it seems like.
Okay, Chris?
Wendy, I think we're extraordinarily fortunate to have you in charge of our health department. I continue to be impressed every time every time you step in front of the county board. That having been said, I would appreciate it if you would take a look at the questions I asked about animal control and get back with me. And I do have a question for Dave. I think what the health department has done, taking a hard look at their phones, have we done that in the departments that we have in the county?
I can't answer that. I don't know the answer to that, but I know that Randy you've met him, he's
Yeah.
our telecommunications person that works in IT, is pretty good about looking for things like that, but I would have to ask him to find out where we are with some of these departments that have people who are out in the field all the time.
Well,
I know that we do have some in the courts, and we have some inspectors and things like that may fall into that category.
It definitely doesn't work for all positions
No.
to sell only.
And I don't mean to infer that it does, but it behooves us to take a look.
In certain circumstances, it really does.
And I did,
There is an email from
yeah, I was just going
from
to
Don
refer to that.
Sheehan.
Yeah. And I'm looking at this, and I'm seeing the county has 29 conference room phone sets. The city has 1. I guess, you know, I am going to have some questions about
So,
phone. I mean, I'm looking for
Okay.
every dollar that I can find.
other questions for the health department? Great presentation. Thank you. You know, it's
Thank
one of
you.
those things I've been trying to talk to Wendy about, that we need a time where we start to educate the commissioners about all the things that the health department does.
Wonderful job.
And because normally speaking, when we see an health department, all we get is you approve this grant, or you approve that grant, and this goes for there, and we don't always get the background as to what's happening at the health department. I think this has been a great presentation, so we understand more of what is really going on. And when we do get these grants, then we may be more understanding about why these grants are so important, where they're going, and why it's important for us to continue with them. So, and Jerry, cost accounting is not the easiest thing in the world. Thank you for what you're doing. We really appreciate it. So, yep, thank you.
Thanks.
Soil.
Good afternoon. My name is Bruce Ramey. I am the Director and Building Official for Grand Traverse County Construction Code and Soil Erosion. I want to thank the Commission for letting me have this opportunity to discuss the Soil Erosion Department and our functions. The Soil Erosion Department consists of 1 full-time office specialist, 40 hours a week, 2 part-time inspectors, certified soil erosion inspectors. They work 18 and a half hours a week each, for a total of 37 hours a week. The Soil Erosion Department is a county enforcing agent responsible for the enforcement of Part 91 and Part 17 of the Natural Resource Environmental Protection Act 1951. The enforcement of this act is mandated by the state and the county soil erosion sedimentation ordinance. Our customers are anyone who intends to make changes in natural cover or topography or land, including cut and fill activities, which may result in or contribute to soil erosion sedimentation of the waters of the state. Those customers include builders, excavators, contractors, developers, and homeowners. In 2013, the department provided service for a combination of permits, extensions, amendments to permits, preliminaries, land division reviews, concerns, complaints, and determinations for a count of 861, plus with an approximate additional 1,000 in customers, response to customers at the counter, phone calls, emails, and walk-in customers at the counter. These services are important because they are mandated by state law per Act 451, Part 91 rules, and they tie into the Board of Commissioners' vision statement and also the strategic goal, number 8, protect and preserve our waters, resources, forests, natural, and the scenic beauty of our county. I am not aware of any legislation changes coming up that would affect the revenue or the function of our department. Demographically, it could change with the increase of population in the county, would increase construction, would increase soil erosion services, and could increase revenue. Department's revenue is based on permits issued annually. The number of soil erosion permits issued increased in 2012 by 13%, in 2013 by 42%. We are expecting 2014 to be another busy year and possibly exceeding 2013. We have discussed the outsourcing of inspection service, and although it may be done and may be possible, we do see some significant concerns. The inspectors would have to be certified soil erosion inspectors. They must be familiar with the soil erosion Part 91 and Part 17 rules. They have to be familiar with the projects, project sites, and mostly our county. They also must be willing to be available when we need them. That could be a problem if they are working on a contract basis. Plus, our current budget is not set up for that kind of contracting.
Okay, Bruce? Bruce?
Yes. Yeah.
If these folks are contracted out, is there a, it would be the DEQ, right? Would have to okay something like that? Is it done elsewhere in the state to contract out those? Because it is the police powers of the state.
Right. They would have to be certified soil erosion and sedimentation inspectors.
Okay, so they would get certification.
They would have to have that certification.
Exercise police powers through that certification.
Right.
Okay, gotcha.
Right.
But Bruce, you said that each of the two inspectors were currently only working 17 and a half hours?
18 and a half hours a week each.
So theoretically, if the workload does increase, which I expect it to from everything I'm seeing in the spring, then we can possibly increase their hours and still meet the needs of our community, correct?
Yes, we would have to. Last 2013, we were maxed out on hours. Basically, two-time part-time inspectors. That's one inspector to cover the whole county. That's a huge task.
But the inspectors we have are available to work some additional hours.
Yes. Yes. I don't see any way that we can reduce a general fund reduction. We are operating with a minimum staff. As I said earlier, we have 2 part-time inspectors. That's 1 inspector to cover the whole county. If we reduce staff, we would not be able to we would not be able to keep up with the workload during the busy season. We fulfill our responsibilities with maximum efficiency with time and resources we allocated. Questions?
Questions? How has your department been affected since you've taken over the soil erosion? And you've been doing it now for 2 years?
Just a year.
Just a year, okay. Boy, how's that affected your department and the services that you're providing for our community?
It hasn't affected our services at all. We're still doing business as usual.
So, but you are more efficient to the customers?
Yes.
Other questions?
I don't have any.
Great job.
All right, thank you.
Thanks for, you guys are really under the gun now. What's your needs for the community or for your budget in the future? I understand you have vehicle challenges?
In our 2014 budget, we have some money set aside to update our computers, which are pretty outdated.
Okay. How about vehicles?
Vehicles, we're in still good shape.
You're all right?
Yep.
Good.
But this is an enterprise fund. and,
Right.
You know, as work increases, the revenue will be there to meet the need as long as the capital is available, or should be.
Well, soil erosion is not part of the enterprise fund. It's
Soil
totally
erosion's not
funded
an
by
enterprise
the
fund.
general budget.
Yeah.
Construction code.
Construction code is.
Construction code is, yeah.
Soil erosion, sorry.
Can we utilize construction code?
Dave, we can't hear you on the
Oh,
microphone.
I'm sorry. Can we utilize construction code funds to pay for soil erosion processing at all?
No.
That money can't
The
be.
law reads that the permit fees that are generated are strictly for construction code
Okay.
department.
So we can just coincide the inspections a little bit, which helps us a little bit.
Yes, we can.
The application process and the clerical stuff, but all of that, there's some efficiencies in doing them
Sure.
both at the same time.
Yeah.
So, do we allocate our secretary or receptionist, what do you call her, the gal in the front office?
Clerk?
Clerk. Do we allocate different monies for the clerk so that we cost allocate for each department?
We do charge the enterprise operation for indirect costs, and they pay rent. The indirect costs include, the administration, finance, human resources. We're not charging indirect costs back to the soil erosion function because of the fact that, the permit revenues are not sufficient to cover the full cost of the operation. You'd be appropriating additional general fund money to cover that. There's no benefit from doing that.
Well, I just didn't know if we cost allocated the clerk's responsibility, because I'm sure there's times when she's working on one and also working on something else. So.
With the person that's charged to the soil erosion function, that individual is working primarily on soil erosion, and Bruce has his staff working. We can't have that split there because of the.
How many in the soil erosion? How many employees?
1 full-time and 2 part-time.
Okay. Very good. Any other questions? Great.
Right.
Thank you.
Thank you.
So hopefully you learned something at the health department while you're sitting here.
We should have let him go first.
Yeah, we almost should have, yeah. Okay, any other questions from commissioners? Public comment? Looks like we chased them all away. We are adjourned.